Right from the beginning of life, parents want to protect their children and keep them safe. There is no question that childhood medical interventions can be necessary and life-saving. Despite their necessity and the best of intentions of parents and professionals, these procedures can often leave lasting and devastating traumatic impacts on our children. Childhood medical trauma is poorly understood and often unrecognized.
The practice of medicine is done to control the behavior of the patient so that it's safe within the context of the treatment. And as a result, there are rituals that are done in medicine that create helplessness as part of that safety insurance. And helplessness, of course, is the substrate that's required for someone to be traumatized. In medical treatment of patients where trauma needs to be mitigated is that in the treatment of children. Children, by their very nature, are always helpless. They do not have the means to defend themselves and therefore need to be treated as if they were going to be traumatized in any contact with a medical procedure.
This video is about how to recognize the signs of childhood medical trauma and how the somatic experiencing method can be used to prevent and treat medical trauma, restore resilience, and alleviate unnecessary suffering in our children. This is Emma's story.
I adopted my daughter from Vietnam when she was 4 months old. And the first day we got her, she almost died. And that led to a long history of a lot of medical trauma and physical trauma. She was diagnosed as being HIV positive, which was later shown not to be true, and was developing infections and had to have many blood tests. She was held down numerous times and had things lanced. And then we got her back to the U.S. after 2 months in Vietnam, and she was found to not have HIV. And then 2 weeks after that, she lost her hearing. So she also ended up in the hospital with RSV, a little under a year old. Multiple IVs, lots of invasive procedures, a lot of trauma.
With surgeries, for example, you have pain, fear and pain, and then going under anesthesia in a disoriented state can be tremendously traumatizing, can potentially be tremendously traumatizing. A child should never go under anesthesia in a frightened state. Nobody should. And a child should never come out of anesthesia in the recovery room alone. There should be somebody there who they know, who they've met before, who can take their arm and say, it's okay.
We happened to meet Peter Levine at a program, and I cornered him and started asking him about her as she was walking across the field and saying she had this trauma and that trauma. And he said, oh yeah, I can see how she walks on the earth, where her traumas were and how old she was, and she should really work with Anna Diwali.
When Emma first came to see me, she was very shy. She was very reserved. Her movements were very limited. She would not explore the space around her. She would come in, sit on a beanbag, and from beginning to end of session, that was her place. Emma was scared and experiencing symptoms related to freeze and immobilization. Her movements were rigid and limited. She was unable to move independently around the house. She could not sleep alone. She was having difficulties with social engagement, and she was oversensitive to sensory input. She was choosing to cope by withdrawing.
A main focus of the somatic experiencing work in Emma's case was in helping her and her parents become more embodied and empowered during the surgical process. The stress and overwhelm was taking its toll on the family. Somatic experiencing helped them cope with their high levels of anxiety and stress and adapt to the procedures with more resilience, embodiment, and advocacy on behalf of Emma.
In somatic experiencing, the child builds resilience throughout sensory motor-based activities. The activities become then the stepstone into their embodiment and empowerment, vital elements for one that's transforming trauma.
By the time we actually went to the surgery, she had made a lot of requests and demands, which is very strong-willed, that were met by the staff. I went into the operating room with her, and she had decided that she was going to put the mask on to put herself to sleep.
I went to special room, and then I asked special that put on mine.
She was just about to put the mask on. She took it off and she sat up and she said, "Okay, I want to know everybody's name in here and what you're going to be doing during this surgery."
And I fall asleep, and then they take me to the operating room, and I said I want to know their names.
And they all like, whoa, and they all took off their masks, even the doctor, and they all talked to her and explained it to her, and she said, "Okay, I'm ready."
Emma developed a strong and coherent narrative when writing her own story. By drawing and through sensory motor play, she experienced the capacity to not only stay embodied, but to defend, protect, and advocate for herself in the face of the surgery. Emma's drawings progressed to show us the renegotiation of the fearful experience. She changed the name of the ambulance to the more whimsical Dingy Belance. The once intrusive sound of the siren that caused her distress and discomfort is no longer part of her reality. The sound is now a softer, more sacred, and supportive tone. She found her voice, asked questions, and was able to let everybody know what she needed in order to feel safe.
So this little girl who had been terrified of everything was able to, in that environment, actually sit up and take charge, and everyone was really impressed. Since then has grown and grown in that, getting that confidence, getting sort of her nervous system working better. She has so much less fears. She's so less sick than she ever was before, and I really saw that step by step through the work with the SE work with Anna.
With time, she found the grace of movement. She was able to explore, she was able to relate, she was able to express herself. She was more confident. She looked stronger. She was then able to talk about the experience as something that had happened in the past, but was no longer scaring her.
She didn't have to relive all of her trauma, either physically or verbally or emotionally, as a lot of approaches, do. You have to take you into it, and she didn't have to do that to be able to have it move through her and be able to regulate herself. It's just the best. I mean, there's so much science and understanding and compassion and heart here.
The somatic experiencing informed approach used with Emma incorporated movement, touch, auditory and visual activities combined with body awareness exercises to help Emma integrate her sensory systems. The Somatic Experiencing Trauma Institute is dedicated to alleviating unnecessary suffering caused by trauma, especially to our most precious, helpless, and vulnerable members of society. Please help us protect our children and keep them safe from unnecessary harm and suffering. Spread the word about childhood medical trauma. Share this video with parents, nurses, doctors, and friends.